USMLE-style question on prolactinoma, pituitary adenoma. Question. A 28-year-old woman presents to the clinic with complaints of headaches, irregular menstrual cycles, and galactorrhea, milk production from both breasts despite not being pregnant or breastfeeding. She also reports a decreased libido and infertility over the past 6 months. Physical examination reveals bilateral galactorrhea on breast examination. Neurologic examination is normal, and there is no visual disturbance. Laboratory studies reveal serum prolactin levels are elevated. Thyroid-stimulating hormone TSH and follicle-stimulating hormone FSH levels are low. MRI of the brain shows a well-defined mass in the pituitary gland. Which of the following is the most likely diagnosis? A. Cushing disease, B. Acromegaly, C. Prolactinoma, D. Non-functioning pituitary adenoma. E. Hypopituitarism due to pituitary apoplexy. Answer C. Prolactinoma. This patient has prolactinoma, the most common type of pituitary adenoma. It is characterized by hyperplasia of lactotrophs, the cells that produce prolactin, and leads to increased prolactin secretion. The clinical manifestations and laboratory findings support this diagnosis. Clinical features of prolactinoma: galactorrhea, milk secretion without pregnancy or breastfeeding; menstrual irregularities, e.g., amenorrhea or oligomenorrhea, due to suppression of the hypothalamic pituitary ovarian axis; infertility; decreased libido; headaches and visual disturbances if the tumor compresses surrounding structures, such as the optic chiasm. Laboratory findings: elevated serum prolactin, most consistent with prolactinoma; low FSH and LH, due to negative feedback by elevated prolactin on the hypothalamus and pituitary, inhibiting gonadotropin secretion. Thyroid function can be suppressed if prolactin levels are high enough. Imaging: MRI of the brain typically reveals a pituitary mass. In prolactinomas, the mass is typically well-defined and located in the pituitary gland. Why not the other options? A. Cushing disease. Cushing disease is caused by ACTH-secreting pituitary adenomas, leading to hypercortisolism. The patient would have symptoms like central obesity, purple striae, moon facies, and hypertension, none of which are present here. B. Acromegaly, caused by growth hormone-secreting pituitary adenomas, resulting in gigantism in children, or acromegaly in adults, enlargement of hands, feet, and facial features. This patient's symptoms do not align with acromegaly. D. Non-functioning pituitary adenoma. These tumors do not secrete hormones and may be asymptomatic or cause mass effect symptoms, headaches, visual disturbances. However, they would not cause elevated prolactin or symptoms of galactorrhea and menstrual irregularity. E. Hypopituitarism due to pituitary apoplexy. Pituitary apoplexy results in sudden onset of severe headache, visual disturbances, and hormonal deficiencies due to hemorrhage or infarction of the pituitary. It usually presents acutely and would not cause chronic symptoms like galactorrhea. Take-home point: prolactinomas are the most common type of pituitary adenoma and cause symptoms like galactorrhea, menstrual irregularities, infertility, and low libido due to elevated prolactin levels. MRI typically shows a well-defined pituitary mass. Would you like